Aisha Haruna is ill, and she's been in Abuja since February. Only now is she able to see a doctor. She is among 47 men, women, and children who fled violence in their hometown of Gwoza, Borno State, and trekked for weeks, first over the border into Cameroon, back down into Yola, and then onwards to Abuja.
To har yanzu yan boko haram sun bi mu to har ma wayansu ma an kakashe su sanan muka shiga ciki to mun ce to tunda muna da hanyar da zamu yi mu samu mu koma Najeriya shine dalilin da muka komo muka zagayen mun bulata ta Yola sanan da kafa ne kuma fa muna dawowa
so they are seeing they no fit stay there. That's why they were thinking let us go back to Nigeria again.
They settled here in Egu at the mercy of the village's residents. It is remote, hard to reach, with poor mobile signal, no electricity, and nearly an hour's drive through rough terrain.
We gathered maize, some of them bring one bag, some of us bring 5 mudu, 1 mudu, 3 mudu, much as we have, we help them with. So the maize we were able to gather in the church, it was about 5 bags. Then the five bags, I think it should be 500 mudus. So that 500 mudu, they share it to them. When they share it to them, we give them accommodation. Unlike this uncompleted building like this, we give them.
Authorities never knew of their presence until now, and it has taken 6 months for that to happen.
It didn't take me so long. It took me longer time to discover who would respond. Immediately I discovered them, I started making noise about whoever cares.
An official of the FCT Emergency Management Agency says the agency has no way of tracking newly internally displaced people settling in Abuja until it is brought to their notice.
When we heard about it from a friend, we decided to pull our resources together as NGOs to provide some form of support for the community. It's a hard to reach community really, but I want to call on the government, I want to call on NEMA to come and support these people and see how we can help them overcome the shock that they went through the insurgency that they had to face in their communities back home in the northeast.
It's a village, so we expect that in this season and the rainy season we're going to have a lot of malaria cases. We also know that they have foods around, so they are going to have schistosomiasis. There will be children with pneumonia and all sorts of infections. We've already begun to see some communicable diseases like chickenpox.
By word of mouth, though the first ever help from outside the Egu comes, clothing, food items, farm implements, but most importantly, medical care.